everyone. Thanks for joining us tonight for this next webinar in the Feline Medicine series. I think this is the fourth webinar that I've been doing for you. So it's a great pleasure for me to be back with you again this evening and to have another topic that I think is not just an enjoyable topic for me to talk about, but also a very practical topic for all of us, and that is managing diabetes mellitus in cats. Now we have a lot to talk about tonight. It's a presentation with a lot of information in it, so we'll go ahead and get started. And let me find our first page here. There. Okay, so we will spend the next hour or so talking about successful management of diabetes mellitus in cats, and really we'll try to cover pretty much the whole area of managing this disease, this very common disease in cats. So we're going to spend the first few minutes talking a little bit about pathophysiology, just to remind you or to update you, depending on how recently you graduated, about what the current theories are about the pathophysiology of this disease and the risk factors. We'll talk about doing that initial assessment of the diabetic patient and what initial diagnostics we need. We'll talk about therapy, including choosing insulins for these patients, and we'll talk about the stabilization phase, where we determine what the maintenance insulin dose will be, and then what our ongoing plan will be for monitoring these cats. So we have a lot to cover in tonight's webinar. I do want to remind you, or let you know if you haven't already seen it, that the International Society of Feline Medicine produced some consensus guidelines from an international panel of experts in diabetes, and this was published in March of 2015. So it's a very current and up-to-date document, and I do like the fact that they made it as practical as possible. And you can download this for free from the web address that's on the slide. The Journal of Feline Medicine and Surgery makes available these guidelines documents to you, even if you don't get this journal through a subscription or through your membership in the International Society of Feline Medicine. So it is a great reason to join the International Society of Feline Medicine, because it does give you access to a lot of continuing education materials, including this journal. But regardless, even if you're not a member, you can download this document for free from this web address. So please have a look at that. It will contain even more detail than we have time to go over this evening for you in this topic. So this is a very personal topic to me because of this cat. This was a cat that I had many years ago. His name was Poodle, and I know you're all thinking that he looks like a very fat cat, and you're right, he is a fat cat. And unfortunately, partly, I'm sure, because of his diabetes, because of his obesity, he developed diabetes. So here's what he looked like 5 years later when he developed diabetes, and he also had developed chronic pancreatitis, and you can see quite a difference in him, the weight loss, the muscle loss, the loss of body condition. And so I certainly know firsthand what it's like to manage a diabetic cat, and not just any diabetic cat, but my diabetic cat was a particularly difficult one to manage. So I have a lot of sympathy with owners, and it has given me a very practical approach to managing this disease in cats, because I now know firsthand what a difference this disease makes to the owner's lifestyle. There's a few chronic diseases in feline medicine that will change the owner's lifestyle as well as the cat's lifestyle, and this is definitely one of them. So I want to remind you that there are two main. One is that these cats have beta cell dysfunction, and that gives them a relative insulin deficiency. So typically these patients are making some insulin, they're just not making enough insulin to meet their needs. And there's any number of reasons why these diabetic patients develop this relative insulin deficiency. It's certainly related to obesity. It may also be related to increasing deposition of amyloid, an acute phase protein that gets laid down in the pancreas over time. We see this amyloid deposition in older cats even if they don't have diabetes mellitus. And that peripheral insulin resistance that we get from obesity leads to some chronic hyperglycemia, and there is some concern that that chronic hyperglycemia is a form of glucose toxicity, that those beta cells actually suffer the toxic effects of that high glucose level over a long period of time. And then obesity also, we now know, is not an inert state. We know that fat cells provoke a state of chronic inflammation in both people and in pets, and probably cause some ongoing both inflammatory damage and some oxidative damage in these cats with diabetes. So by one or more of those mechanisms, we do get this beta cell dysfunction. And we also get in these patients a relative insulin resistance. So again, obesity is one of the main factors there that causes that peripheral resistance. Some drugs, and probably the best known there would be the corticosteroids like prednisone or prednisolone. Probably many of us have seen patients that have developed diabetes after having been on prednisone or prednisolone. So that's another factor. We'll talk about a couple of endocrinopathies just briefly that might be underlying factors. And like my cat, some cats develop diabetes after having had chronic pancreatitis. So with a long struggle with chronic pancreatitis, they may have beta cell dysfunction as a consequence of the pancreatitis and then become diabetic afterwards. So we sometimes see it as a feature of chronic pancreatitis as well. So there's a number of mechanisms for both of these key underlying problems, pathophysiologic problems. And what they lead to is a whole variety of abnormalities in metabolism of carbohydrates and fats and proteins in these patients that leads us to the clinical signs and the physical exam findings that we see in these cats. So it's a complicated disease. And in fact, it's probably a heterogeneous disease because, as we've just alluded to, patients can become diabetic through a number of mechanisms, and so the disease doesn't always look the same in every patient. And you've seen that yourself. I'm sure you've seen diabetic cats that are relatively easy to control, but you've also met probably diabetic cats, like my own cat, that were difficult to control. So there are a variety of clinical outcomes, probably because there's so many underlying mechanisms or factors involved in this disease. So it might be better to call it a syndrome, actually, because it's really not one clean-cut disease. We have a lot of variety in our patients and how they get diabetic and then what their clinical outcomes are. In cats, most of our patients would be most similar to the type 2 human patients, so we call them type 2-like diabetic patients. And as in people, the main factors are just advancing age, so it's more common as cats get older, obesity and inactivity, and we've already talked about some of the ways that obesity plays a role there. In people, genetics may play a role, and it's probable that it does in cats too. We just don't fully understand the role of a genetic predisposition to this disease, but it's likely that at least for some cats that a genetic predisposition is at play as well. So we don't really know unless there's been a predisposing drug or predisposing disease. In most cats, we can't really pinpoint a specific etiology. So it is a diagnosis of exclusion, and we're going to talk about the diagnostic workup. So whatever it is, it leads us to this pathway that gives us that relative insulin deficiency and that peripheral insulin resistance. So that's the most common type in cats, the type 2 like. Very occasionally, we will see a cat with a secondary diabetes mellitus that is secondary to another underlying endocrine disease. And probably the two most common endocrine diseases that can lead to diabetes are acromegaly and Cushing's disease, or hyperadrenocorticism. And in both of these cases, cats have typically other clinical signs that point to another disease state. And the other way that you'll know that they're not, I guess, an ordinary diabetic with one endocrine disease, but diabetic with two endocrine diseases, is that typically these are cats that need very, very high doses of insulin to control them. So they might need 20, 30, 40 units of insulin, whereas we'll see the average cat needs somewhere between, say, 1 and 4 or 1 and 5 units of insulin. So that's often one of our clues that we might be dealing with a diabetic patient that has an additional endocrine disease. But again, that's less common. So if this whole idea of classifying diabetes and understanding pathophysiology is of interest to you, just in July of last year, a really interesting article was published in the Journal of Veterinary Internal Medicine, and hopefully all of you know that the articles in this journal are now all open access. They're now all free. So if you just Google for the Journal of Veterinary Internal Medicine website and go to the July 2016 issue, you can download this article that's a nice discussion of where we are with our current classification of diabetes mellitus in veterinary medicine, why we might have to think about it a little differently than the way we were taught in school, and what are some of the current thoughts about how this matters to the way that we manage these patients. So I'd recommend that article to you if you're interested in this topic. But maybe before we go ahead and talk about the clinical signs, I'm going to see if I can send the first poll into our room here and ask you how many of you have diagnosed a cat with diabetes mellitus within the last month. So if you can think of one within the last month, let me know if you've diagnosed a cat. Just gives me an idea of roughly the frequency with which you see these cases. Obviously, there's no right or wrong answer to that question. Just interested to see how many of you have seen a cat, let's say, within the last month. So we'll just wait another moment for the rest of the votes. Okay, so it looks like most of you have your votes in there, and the majority of you said, yes, I have seen a cat within the last month with diabetes mellitus. And so that's really what I would expect, because the disease is so common that typically we would see at least one cat within a month. Of course, it depends on the percentage of feline patients that you have in your practice. So the clinical signs of diabetes mellitus in cats are not very hard, I guess, to recognize. Often owners recognize one or more of these clinical signs at home. Probably the most common are weight loss despite a good or even increased appetite, along with increased thirst and increased urination. These cats may also have changes in their behavior or their activity level. They may be less active. They may actually be a little bit weak. And I'm going to hopefully play a video for you in a moment of a cat with a peripheral neuropathy that we sometimes see with patients. And then some patients will actually present in a more serious or more advanced disease state. Some of your patients, hopefully not too often, can actually present in ketoacidosis. So if they've gone unrecognized for a long time with their disease, you might actually see them in a very, very critical state. But I think more typically we see cats when they've got these clinical signs of disease. So the risk factors, the cats that are most likely to develop diabetes mellitus would be a male cat. So about 60 to 70% of our patients are typically male cats. Yes, we definitely see female cats with diabetes, but male cats are a little bit more common, partly because their body fat percentage is higher than in female cats. Their growth rate and their body weight tends to be higher than in female cats. And we've already mentioned inactivity. So this indoor inactive lifestyle is a risk factor. The Burmese breed, certainly in some countries, especially Australia, the UK, that's probably an example of a genetic predisposition. It's not true in North America, by the way. Burmese cats that are born in North America come from different genetic background, and they don't have a genetic predisposition. Definitely more common with age. We've mentioned that already. So most patients are 6, 7 years of age or older. So as they get over 7 years of age, it's more common. We can more commonly see diabetes with concurrent diseases, and I mentioned chronic pancreatitis already as one of the diseases that can sometimes lead cats down the pathway where they develop chronic pancreatitis, and drug treatment, and there in cats the big one would be corticosteroids. Often those cats, if we can reduce or eliminate their corticosteroids, they may be able to revert to a non-insulin dependent state. They're usually obese or overweight cats anyway, and then we put them on corticosteroids. So those are the common risk factors, and nothing really much has changed in those risk factors in recent years. So when we're making a diagnosis of diabetes, we do often have already a suspicion based on clinical signs. But of course there are other diseases that have some similar clinical signs, so we have to rule out the other diseases. And we're going to confirm our suspicion of diabetes by finding a persistently high blood glucose. We're going to talk about fructosamine in just a moment, and the pros and cons of using fructosamine, especially to distinguish cats that may have stress hyperglycemia. And then typically cats will have glucosuria as well as part of their diagnosis. But we do have to rule out diseases that look similar. So these would be most commonly hyperthyroidism and chronic kidney disease, both of which can cause increased water consumption, increased urination, weight loss. Hyperthyroidism often causes an increased appetite. Probably the other category of disease I would add there would be gastrointestinal disease. Those cats often lose weight as well. So we do have to have a good workup of these patients and make sure that we understand all of their diseases. Stress hyperglycemia is a particular problem that we have to rule out, because cats are good at becoming hyperglycemic when they're stressed, and even when they're sick with other diseases, they might be hyperglycemic and yet not be diabetic. So that's well illustrated by this study that was published actually quite a long time ago, but it was looking at over 2,000 sick cats that were referred to a university-based veterinary teaching hospital for diagnosis, and those cats had all different kinds of disease. And you can see that 36% of those cats were hyperglycemic, but only 2% in the end were actually diabetic. So stress hyperglycemia is quite common in a sick cat group. And we can't distinguish stress hyperglycemia from diabetes on the basis of how high the blood glucose is. We can get just as high a blood glucose in many cases from stress as we can from diabetes. So it can be very misleading to simply look at the blood glucose value and say, oh, I can tell by the value that this cat has stress hyperglycemia versus true diabetes. So we have to be very careful about that. So that's where a test like serum fructosamine can be useful to us. So high values on this test do indicate poor glycemic control, or in other words, a persistently high blood glucose, but only for the previous week. We used to think it gave us a much longer view of blood glucose, average blood glucose in the cat, but it's only about a week. So, nonetheless, it's quite useful for looking at the cat that might have a stress hyperglycemia. So those cats should have a normal serum fructosamine in the face of a high blood glucose. So that's one of the best uses of this test. We do have to bear in mind, if we're using it to help us monitor diabetics on an ongoing basis, that it is influenced by things like the weight of the cat, the body condition score, the sex of the cat. Males tend to have higher fructosamine readings than females. Other diseases, so uncontrolled hyperthyroidism makes our fructosamine values unreliable until the hyperthyroidism is treated or under control. And we do have some interest in looking at fructosamine for detecting cats that are developing diabetes but might not yet be diabetic. But now that we know it only gives us a look at glycemic control for the previous week, it's probably not a good test for that, for trying to determine which cats are trending towards diabetes. Now we're beginning to see A1C tests, glycosylated hemoglobin tests, come on the market. There's one on the market in North America now, and that gives us an indication of average blood glucose readings for the previous 70 days, so a much longer timeline, and that might be a better test for things like trying to detect the cat that's trending towards diabetes. So we're going to use serum fructosamine mainly for ruling out stress hyperglycemia in our patients. So we do need a full health assessment on these cats, so a good physical exam, their weight, their body and muscle condition score, blood pressure assessment, mainly because that is should be, as long as you have the equipment, a routine part of assessment for all middle-aged and older cats anyway. Of course, a medical history, including any medications that they may be on, and a diet history, because we're going to talk about dietary change for these cats as well. So we do need a good look. We do need to evaluate for some particular problems, so complications that we've already mentioned, like peripheral neuropathy and diabetic ketoacidosis. We won't have time to talk about management of ketoacidosis patients tonight. That's a whole other topic, but occasionally a patient will present to you like that. Concurrent problems, and one of the most common ones there would be infection, and the two places where I would most likely find infection in the diabetic cat would be in the mouth, as in the picture you can see on your screen. So cats that have significant dental disease, like this cat has a lot of periodontal disease, that's a common occurrence in middle-aged and older cats, and urinary tract infections would be the other case. So if we do identify a cat with significant dental disease like this cat, we would want to get those teeth treated, get the teeth cleaned, get any diseased teeth removed as quickly as possible, because it won't be possible to get good regulation of the diabetes in that cat as long as there is infection and inflammation in the mouth. So quite early on, we're going to get that cat in for dentistry and get the mouth cleaned up. And then, of course, there are some conditions that will just make it maybe more difficult, certainly more costly for the owner to manage along with diabetes. So we do want to make sure, do we know if our patient has any concurrent kidney disease? Is there hyperthyroidism? Is there gastrointestinal disease? These older patients are at risk of cancer. So we do want a good health assessment, so we're able to give the owner as much information as possible about how we think, or what we think the prognosis will be for their cat, and also that will help them understand what the time commitment will be, how intensive the treatment will be, and what the cost will be for those patients as well. Fortunately, there are some complications in people that are uncommon or rare in cats. And I always ask owners what their experience is with diabetes when we diagnose a new patient, because many people have had some experience with diabetes. They know a friend or a family member, or they've had a previous pet, and they may have some misconceptions in their mind about diabetes, especially if they're thinking about people with diabetes. So I always make sure I let them know that ocular problems like cataracts and glaucoma and uveitis are really rare in cats with diabetes. The same with peripheral artery disease. That's common in people with diabetes, but it's not been documented in cats. Some diabetic cats will have hypertension, but there isn't a strong link between those two diseases the way there is in people. So a lot of the problems that they might be worried about because they're familiar with diabetes in people actually don't occur in cats. So that's a little bit of good news for them. So we do see some cats with a peripheral neuropathy, and hopefully we'll get a video to play for you here on this slide. I have a bit of a slow internet connection, so this video may or may not play for us. Peripheral neuropathy happens most typically in the tibial nerve of cats because it's a large nerve, and it happens with chronic hyperglycemia. So over time, with this ongoing high blood glucose, these cats will tend to develop some swan cell injury. They may also have defects in their myelin, and they have some microvascular pathology as well. So it happens to maybe as many as 10% of cats. It means they've had their hyperglycemia for a long time when we see neuropathy. It can affect both the front legs and the hind legs. The cat in the video actually has both front and hind legs affected, but certainly compared to how common this is in people, where it affects 60 to 70% of people, it's far less common in cats than it is in people, and again, only with long-standing hyperglycemia. Once it does occur, it does take a long time for the nerves to repair. Once we get control of the diabetes and we get the blood glucose down to better levels, it will take weeks to months for the nerves to repair and for that peripheral neuropathy to resolve. So in order to have a full assessment of our patients, we do need a minimum database. So that means a complete blood count, a serum chemistry panel, a total T4, a urinalysis and a urine culture, because there is a risk that these cats have a urinary tract infection, and it's usually occult. There's usually no clinical signs. We might do a serum fructosamine if we're concerned about stress hyperglycemia versus true diabetes. And we might actually order additional tests like a PLI if it's a patient where we're concerned that they may also have concurrent chronic pancreatitis, or it's a patient that you've suspected in the past has chronic pancreatitis like my cat did, that's leading them to diabetes. So there may be some additional tests, but at a minimum, we want that blood count, complete blood count, the chemistry panel, the T4, the urinalysis, and the urine culture done on these cats, so that we get a full assessment of their status. So I always like to remind owners or talk to owners about our goals of treating these cats. Often what owners want is to get a cat to a non-insulin dependent state. And we're going to talk in a few minutes about which patients are most likely to develop a non-insulin dependent state. So over and above that, though, we want to minimize the clinical signs because owners find those distressing to see. Certainly from the cat's point of view, it's about quality of life. So we want to improve that cat's quality of life so that they can do the normal cat things that they should be doing at that stage of their life. And we want to prevent complications. So we don't want patients to develop ketoacidosis or the peripheral neuropathy or hypoglycemia, a common complication of treatment, which can be anywhere from mild to devastating for a patient. So we want to think about preventing all of the possible complications in these patients as well. So if those are our treatment goals, how do we accomplish those goals? Well, probably the key thing is that these patients need to be treated with insulin and diet to get their blood glucose down to a healthier level. So we do not try to get their blood glucose down into a laboratory normal reference range, but I'll show you what our targets are in a few minutes, but we do want to get them down to a level where it is healthier for the cat. And the only way to do that is through starting insulin and we're going to talk about diet as well. So there really is no point in delaying insulin therapy for these cats. But we have to have an informed client so they understand the disease and the need for regular monitoring. As I mentioned, we have to look for infections, look for urinary tract infections and treat them. If there is dental disease, get that treated early on so that we can get the cat stabilized. And above all, try to get the cat under treatment quite early after the diagnosis. So the sooner that we get working on these things, the better for the cat. So I said I'd mention what are the predictors of remission, and so that's my own cat in the picture there. My own cat, Poodle. This is Poodle again, and Poodle is not a patient that we would expect to get remission in, mainly because he had a concurrent disease. He had chronic pancreatitis. So the cats that may end up in remission are the cats that are newly diagnosed and have no concurrent diseases, or at least no significant diseases that could involve making their diabetes difficult to manage or insulin resistance. So they're fairly, we would say they're a clean diabetic. They don't have other health problems. They need to have an owner that's committed to treatment and getting them under good glycemic control fairly quickly. We're going to talk about dietary therapy, so treating obesity if the cat is still obese, and then a diabetic management diet. And if it's going to happen, if these cats are going to go into remission and get off insulin, it typically happens within the first 4 to 6 months after diagnosis. So we do occasionally see cats that go off of insulin later than that, at a year or 2 years. It's just less common. It's most likely to happen within the first 4 to 6 months. And I always warn owners that cats that go off insulin, I really still consider them diabetic. They're just not insulin dependent. They may recur with a need for insulin again in the future. So it's actually really common for us to see cats that go off and on insulin. Sometimes it's because, like my cat, they have an underlying disease that waxes and wanes. Sometimes it's as they develop or they gain more weight, then they might need to go back on insulin. So while we may get some patients off of insulin eventually, I would never guarantee an owner that they would stay off of insulin. I think that's an important point for owners to know. So let's talk a little bit about dietary therapy first. And I think about this in two types of diets. So if the cat is still obese, because most cats that develop diabetes at least were obese, they may have lost enough weight that they're not obese anymore. But if they still are obese, then we want to prioritize weight loss and get them as close to a normal body weight as possible, because we know that treating obesity improves their glycemic control, their insulin dose will be lower, and they will have a better chance of disease remission, or at least remission from needing insulin treatment. So that would be my number one priority. Once they've lost weight, or if they already, because of the disease, lost a lot of weight, and we don't need a weight management program, we would go ahead and put those cats on a diabetes management diet. And I've just put a few examples of diabetes diets on the slide here for you. There's many different examples of both weight loss, weight management diets, and diabetes diets. And I don't think we have enough information at this point to say that one is any better than the other. The studies that look at the influence of diet simply show us, I think, that being on a diet that's intended for diabetes management improves control of the disease, and certainly is one of the factors in why some cats will be able to get off of insulin treatment. So we either want a weight loss diet or a diabetes management diet. Now you may have patients that need a different diet because they have some other disease and we can't change their diet. A food allergy patient would be a good example of that, where we're really reluctant to change the diet because we've gotten an allergic condition under control. And so there are, of course, some patients where we can't change the diet. But if we can, then these are our two priorities. So before we go on to the next slide, I'm going to see if I can send another poll into the room here. And I'm going to ask you If you have ever treated a diabetic cat with an oral drug, an oral hypoglycemic drug, typically this would be one of the drugs that's used to treat people with diabetes, because there's a number of these on the market. And certainly owners often ask us about these drugs, especially if they have any familiarity with a family member or a friend that's had diabetes. They might ask you about these drugs. So just before we say a word or two about human treatments, I'll just get your experience with using these drugs. Okay, so it looks like most of you have voted, and the majority of you have said nope. I have not used an oral hypoglycemic drug in cats, and that's probably the case for most of us. The drug that has been uh, researched, I guess, or examined the best is glipizide. This is a human oral hypoglycemic, and it works by stimulating insulin secretion from pancreatic cells. The problem is it may be asking the few remaining pancreatic cells that your patient has to work even harder than they normally would. And so our concern is it may lead to burnout of those remaining functioning beta cells, and then we'll have a patient who can't make any insulin at all, and they're in a permanent diabetic state. So the other problem we have in cats is that the response rate is very low. It's only about a third of cats have any response to this type of drug, and it takes a long time, typically 2 to 3 months. And in that 2 to 3 months, of course, a lot of complications could occur with these cats. And there is a group of cats, about 10% of cats, that do experience liver toxicity from these drugs, and so they cannot take them. So they really are not a good choice for our feline patients. They would really be something that I would use only as an extreme last resort, because the track record is so poor. Other drugs have been tried. Some of the other human drugs have been tried in cats, and none of them have any good track record in cats. I'm just going to mention a new type of treatment, because we're beginning to see some new drug approaches come on the human market, particularly this drug class that's called a GLP-1 analog. This is an incretin, I-N-C-R-E-T-I-N, incretin-based treatment, becoming very popular in people because it's a once monthly sub-Q injection. And it has been evaluated in cats. There's a nice article in the Journal of Feline Medicine and Surgery last year, and those researchers concluded that this approach, although very attractive, obviously, just a monthly injection, would work the best only in cats that have the absolute earliest diagnosis. And unfortunately, certainly compared to people, we diagnose our patients later in disease. So we might be diagnosing our patients too late in disease for this new type of drug approach. And it has to be a patient that has absolutely no concurrent diseases. So that means there's only going to be a very small subset of cats where this might be of use. But it is an area of research we want to keep an eye on, because there are new treatments coming along all the time for people with diabetes, and we may come along with something that's going to also be attractive to us in cats. But for the time being, we do have to rely on insulin. I would say there is no perfect insulin for cats. Hopefully you will find one that works for your patient, but I can never recommend you any specific type that I think is best for all cats. And that's because there is variation in individual response. So, and that's somewhat unpredictable. So I think you do need to be familiar with at least 2 types of insulin. So maybe you have your own favorite, and that's fine, but you should be familiar with at least 1 additional type of insulin in case you have a patient that does not do well on your first choice. So my rule is that I recommend that veterinarians be familiar with more than 1 type of insulin. So before we talk about insulins, I'm going to send another poll to you, and we're going to ask you about the type of insulins that you use in your practice. So I've put 2 veterinary insulins on the slide, the CAN insulin, or Vetsulin as it's called in the US, Prozinc, which is made by Boehringer, not available in all countries, but it is a veterinary protamine zinc insulin, and then the two human insulins that also get used, Lantus brand name, glargine insulin, and then Levemir, the brand name, which is Detamir insulin. Okay, so we'll just give another minute there and see what you all say. Okay, looks like most of you have voted, and so the majority of you did say the can insulin, and a few of you picked Lantus as the type of insulin that you use in your practice. And I would say that's pretty common, actually, a pretty common breakdown of responses that I get, where Prozinc is available in some countries. That's also used. But the can insulin and Lantus are probably most commonly used. So how do we pick an insulin? I think we have to think of course, what's available in your country. You have to look at what's licensed in your country. We would always want to choose a licensed insulin before we choose a non-licensed insulin. How easy is it to dose? This may be very important for some owners. The U100 insulins like Lantus, cats require very small doses, and they may be very difficult for owners with poor eyesight or senior citizens to measure. So ease in dosing sometimes is the deciding factor. Affordability, there's variations in the cost of these insulins. That might be a deciding factor. And of course, what type of product support we can get. We really only get good product support from the veterinary licensed insulins. So there's a number of factors that lead us to choose insulin. So of course, the two veterinary insulins that are available in many countries, probably the most common is can insulin. It's also called Vetsulin in some countries, and it's a porcine lenti. And a little bit newer than that from Boehringer is the recombinant human PZI insulin that's called Prozinc. So these are both intermediate acting insulins, but they're U40 insulins, which is good because cats require small insulin doses, and U40 insulins are easier to measure. That's one of their big advantages. So those are the two veterinary insulins. If you're using can insulin, I don't know if this is available in your country, but the company does make a pen, an insulin injection pen, that's available in many countries that goes along with can insulin. So you buy cartridges that go in the pen, and the cartridges contain just over 100 units. They have very fine needles. They are meant to be stored at room temperature, so they'll last about a month at room temperature. You can refrigerate them, but they are meant to be stored at room temperature. They come in two sizes. One size that's better for dogs because it measures 1 to 16 units in 1 unit increments, and then it also comes in a smaller size going up to 8 units. It's better for cats. So and it measures in half or 1 unit increments. So for owners that are having difficulty dosing insulin, or where we're concerned that variations in inaccuracy in dosing are part of the problem, we'll often get owners to use this pen. At least in Canada, it's not terribly expensive to buy. It's very durable. The pen itself lasts a long time. There is a little increased cost because you have to buy cartridges of insulin instead of the vials. But for some owners, they find this much easier to use than an insulin syringe. So if it's available to you, that's another option with the veterinary insulins. And then the human insulins, of course, the two that are most commonly used in cats would be Lantus and Levemir, and probably of the two, it's Lantus that's been used the most often. It's a U100 insulin, so it does need U100 syringes, and we try to find not 1 ml syringes, but 0.3 or 0.5 ml syringes. That makes it easier to measure these small feline doses with a U100 insulin. So try to get syringes that are smaller than 1 unit to make dosing a little bit easier for these. So there is a fair bit in the veterinary literature about using Lantus. There's not a lot about Levemir. So I thought I'd show you this study on Levemir that was published in 2015 in the Journal of Feline Medicine and Surgery that looked at 14 cats treated with Levemir, brand name Levemir, insulin detamir. And what was interesting to me with this study is that 5 of those cats had previously been on another insulin and had failed to achieve control. So as I mentioned, we do see some cats that won't respond to your first choice of insulin. So 5 of these cats were insulin failures. 13 out of the 14 did very well on this insulin and achieved good glycemic control within about 3 months. Starting dose is typical, so most insulins have this same starting dose. This is unique to detamir, a quarter to a half of a unit per kilo twice a day, and that's based on the initial blood glucose. If it's below 20 millimoles per liter, we'd start at a quarter of a unit per kilo, and if it's above, we'd start at half a unit per kilo. But again, there's nothing unique about that. Most of the veterinary insulins are going to use this exact same starting dose, which makes it, that's good because it's easier for us to remember. So another human insulin that has been evaluated in cats. It is important that the owner knows that there is more than one type of insulin on the market, and especially if your clinic sells both U40 and U100 insulins, we have to be careful not to mix up the syringes. So the owner must be made aware that there is 2 different types of insulin, U40 and U100, and the syringes have to match the insulin. They shouldn't reuse the syringes in an attempt to save money because the needles are single use, and at the second use, it will hurt the cat and they will start to get resistance from their cat. Of course, the hardest thing for owners to, I guess, abide by is they should never change an insulin dose without talking to us. So they can't take control to that degree in their own hands and make their own judgment about changing dose. And I usually ask owners to feed some of the morning meal before they give that morning insulin dose, not because you need to time insulin dose to food in cats, you don't. I'm just checking to see if the cat is eating that day, feeling well that day. That's the only reason. It's just a little way for me to ask the owner to check, how's your cat feeling today? Are they going to eat their breakfast? And if they don't, if the cat doesn't come, it doesn't want to eat, then at least it's a moment for the owner to say, oh, maybe my cat isn't feeling well, I need to call the veterinarian. So we don't have to time meals with insulin in cats. So it's really just me doing a little bit of a check to see if the cat is feeling well that day. And owners do need to monitor some things in their pets. So we'll ask them to monitor food intake and water intake, urine output if they're using a litter tray in the house, at least to look at the size of the clumps in the litter pan. And they should be aware of the signs of hypoglycemia. So in cats, the early signs of hypoglycemia are really kind of vague and nonspecific. So a bit of lethargy or weakness that will progress into some trembling, then ataxia, and then eventually, unfortunately, seizures or even a coma. So we'd like owners to recognize those first early signs, the lethargy, maybe a little bit of trembling, and treat them with some oral glucose. Corn syrup works well. Any oral sugar solution will absorb across the mucous membranes of the mouth so that they can treat them quite quickly, and then they can seek veterinary attention right away. Hypoglycemia is relatively common when we're treating diabetic cats, so owners do need to know the clinical signs. And owners can keep a diary themselves, or you may be able to get a form for a home care diary. This is the one that Boehringer makes that goes with their insulin. You can find different ones online. You might make up forms yourself. Doesn't matter as long as the owner keeps some basic record of things like the insulin dose every day, the cat's food and water intake, urine output, and things like that. So we do want some type of record keeping from the owner. We also teach the owner that there are certain sites that are better to inject insulin on the cat, and that is along the lateral body wall. So we want to inject insulin in the sites where it will be best absorbed. So that could be over the ribs, it could be over the lateral abdomen, or it could be over the lateral hind leg, over the thigh. All of these areas have thinner skin and better vasculature. better blood vessels. So insulin is actually better absorbed somewhere along the lateral body wall. If we inject it in the scruff of the neck, as most of us have done, yes, it's absorbed there, but it's not absorbed as quickly or as completely. So we do want owners to learn to inject on the side. Often I'll teach owners to inject in the scruff of the neck. It just seems to be easier. And once they're confident with their injection technique, I have them move down to the body wall and inject one injection on this side, then the next injection on the other side, and so on. So we do want to educate them about that. There are some nice websites with videos about doing things like measuring insulin, injecting insulin, doing home blood glucose curves, which we're going to talk about in a moment. And one of them is the Feline Health Center from Cornell University. They have put together a series of videos on a website called Partners in Animal Health, and you can access it through this web address that you see on your screen. So they have a very nice video series on caring for diabetic cats. They also have videos for other feline diseases too that are worth looking at, but they have a particularly good series of videos on things like measuring insulin, injecting insulin, what about hypoglycemia, home blood glucose curves, and so on. So those are worth looking at. And the other is the International Cat Care, which is the parent organization for the International Society of Feline Medicine. They have a very nice YouTube channel with a lot of videos there. And on the topic of diabetes, they have a nice video on how to give your cat an insulin injection and how to do home blood glucose testing for diabetic cats. So there are some very nice online resources that you can use as backup educational tools. I also recommend that if possible, the owner teach somebody else in their home or a friend to inject insulin. And you want more than one person to know how to give insulin to a diabetic cat in case the main caretaker, maybe they have to go away, or what if that main caretaker gets sick and can't treat the cat. There should be somebody else. And so these videos are a way to teach other people about care of diabetes in that cat. So we've talked about insulin. We haven't talked much about the dose. What is the right insulin dose? Well, the answer is it's the dose that controls the hyperglycemia and the clinical signs, and that's going to vary from cat to cat. But cats do typically take small insulin doses. We're looking at somewhere between 1 and 5 units would be very typical for a cat. Once we start getting above that, I start to get a little bit more concerned that something is not right, and we'll talk about that in just a minute. So unfortunately, some of the words are missing from this slide, but what it says is the starting dose is based on ideal body weight, and we already talked about starting at 1/4 to 1/2 unit per kilo based on that initial blood glucose, whether it's under or over 20 millimoles per liter. In practicality, that means cats generally start at either 1 or 2 units a day. So if you just want to forget the whole thing about dosing on weight and say it's 1 or 2 units per kilo twice a day, that's a good starting dose for any insulin. They're all the same in cats. We can think of it that way. So just to give you an idea again what median maintenance doses are for those intermediate insulins, like can insulin, for example, most cats are going to be managed on about 1/2 unit per kilo BID. For insulins like Lantus or Glargine, 2.5 units per cat. So total 2.5 units per cat would be a pretty common dose. So again, in general, cats should take small insulin doses to stabilize. So we'll recheck them at 1 week. Weight, body condition score, ask about clinical signs, ask if the owner is having any problems administering the insulin. And at this point, if the owner is coping well, we may introduce home blood glucose measurement and ask them to do the first home blood glucose curve at this point. Depends for some owners, if they're really struggling to get comfortable with their pet's diabetes, then I might wait till later to teach them about how home blood glucose curves. At the second week, again, a physical exam, weight, body condition score, same questions, clinical signs. If we've got blood glucose curves to look at, great. We do prefer to do them in the home. And generally, we're going to recheck these cats weekly or every 2 weeks until they're stable. We'll ask the owner to do a home blood glucose curve about once a week. And on average, it takes 2 to 3 months to stabilize a cat. So it's good for owners to know that. We may make a lot of headway in the first month or 6 weeks, but it typically takes 2 to 3 for owners to know that stabilization does take a little bit of time, and they'll be seeing us fairly frequently in that first couple of months until we get things stabilized for their pet. So I did want to talk a bit about blood glucose curves. They are the best way to achieve glycemic control because just doing a spot check is very misleading. We never want to rely on that except to identify hypoglycemia. But you do have to be careful because blood glucose curves can be inaccurate, and we always have to look at what the patient is telling us. Always believe the patient and what they are telling you before you believe a blood glucose curve. So if the information from your curve does not agree with the condition of your patient, always believe the patient first. So before we talk about home blood glucose curves, let me just send another poll in here, and I will ask you how many of you teach owners to do blood glucose curves at home for managing your diabetic patients. So do any of you do that? It'll just give me a little bit of an idea what your experience is. Certainly not possible for all cats by any means, and it's not possible for all owners. But when it is, of course, we do like to get owners to do this at home. So looks like most of you have voted, and actually it's about half and half. So about half of you do teach owners to do it at home, and about half of you don't. So there are some potential advantages to doing it at home where we think the cat might have a normal routine, might eat more normally, might be less stressful. I still think there's stress involved with having a blood glucose curve done even if it's at home. Owners might not be able to do it alone. They might need an assistant. The cat may not be any more amenable at home than in the clinic. It does take time, but if nothing else, we teach owners to be able to do even a spot blood glucose check to identify hypoglycemia. So even if we teach them just to do the occasional check, if they're worried about hypoglycemia, even if they can't manage a curve, it's useful for that purpose, if for no other purpose. We do get disagreement in blood glucose curves. So this study looked at 12 cats that had blood glucose curves done at home versus in the hospital within a week of each other to see if there was a difference between the readings in the hospital and the readings at home. 2/3 of the time, the readings were very similar. The curve at home and the curve in the veterinary hospital were similar. 1/3 of the time, though, they weren't. 1/3 of the time, the curve results disagreed. Usually not a big difference, but in some cases, you might have made a completely different decision for that cat, depending on which curve you looked at. So, and there wasn't an agreement between for which was the best curve. Was it always the curve at home that was correct, or the curve that was in the hospital? Sometimes it was the hospital curve that was correct. Sometimes it was the home curve that was correct. So we have to be careful about that. Just some cats don't find it any less stressful to have the curve done at home. We often, at least certainly in the past, use these glucometers that were meant for people with diabetes like this one. They're often readily available, but there is a different distribution of glucose between plasma and red cells in people versus dogs and cats. So you get both over and under estimates of blood glucose, unfortunately. So If that's the only type of blood glucose meter that is available to you, we definitely can use them. We can use them to follow trends in our patient. We can use them for curves, although again, I would always be careful to interpret it in light of your patient. It turns out that the meters made for people, at least based on this study where they looked at home blood glucose monitoring with a human meter in dogs and cats, the meter performed the best when whole blood was used. It didn't perform well when it performed the best when serum was used, but it did not perform well for whole blood. And of course, in a home setting, that's what our clients are using. They can't use serum, they can only use whole blood. So the meters for people are not as reliable for animals. If you are able to get a veterinary meter, and there's a couple of them on the market. This is an example of the one that we use in my practice. This is the Alpha Track from Zoetis, but I know there's other ones on the market. A veterinary blood glucose meter is always best because they are calibrated for cats and dogs, and they use very small blood samples. So we would always recommend a veterinary meter before we would recommend a human one. When we do look at a curve, we want to ask a couple of questions. We want to ask, is the insulin being absorbed? How long is the effect of the insulin? And what is the low point? How low does it go? And when in the day does that occur? So we'll look at a blood glucose curve to answer those questions. So this, I guess, would be an example of a perfect blood glucose curve, which we really hardly ever see. But for the purposes of discussing evaluating the curve, we'll look at this curve. So we want to ask ourselves, was the insulin absorbed and did it take effect? And yes, it did, because the blood glucose started up here at 20 at 8 a.m. and it decreased through the day. So we know the insulin was absorbed and we know the insulin took effect. The duration is the time period from whatever your starting was, and it was, let's say it was 20 in this cat, and when does it come back to the baseline of 20? So in this cat at 8 a.m., the reading was 20, and at about 9 o'clock roughly at night, the blood glucose level returned to 20. So that's a roughly 12-hour duration of action. So that length of time tells us the duration. And then the nadir, of course, is the lowest point. In this pet, the nadir was about 9 millimoles per liter. And it occurred roughly halfway through the day in the early afternoon. So those are the questions that you want to ask to evaluate if that insulin dose and if the insulin is working appropriately for your patient. And with some targets in mind, so I like the average blood glucose readings throughout the day for a well-controlled patient to be between 6 and 14 millimoles per liter. And I like that nadir to be somewhere between about 4.5 and 8. So no higher than 8, no lower than about 4.5. If we do want to make a dose adjustment, we're going to adjust it only by about half a unit to maybe as much as 1 unit, and no more often than once a week. It takes at least a week for the cat to adjust after you make a change in insulin dose. So we would do a curve again in about a week. So we do blood glucose curves during the stabilization phase while we're adjusting insulin dose. We would do it when there are any signs of poor glycemic control. So when we think we need to adjust insulin or when there's a hypoglycemic episode, and then a week or two after any insulin dose change. But if your patient is doing well, their body weight is stable, their clinical signs are controlled, everything is going well, I don't use blood glucose curves in those patients. I don't do them unless there's a reason. As you can see on this slide, these are the reasons I would do a curve. Otherwise, I just monitor by the patient the clinical signs and weight to tell how they're doing. There are cats we can't do blood glucose curves on. So we're going to monitor these cats by clinical signs, by their food intake, their water intake, their urine output, periodically look at some blood work on these cats, a fructosamine or an A1C test if that becomes available to you. And in general, we'd be a little more conservative with our insulin dose because we don't have the ability to do curves. So we certainly can monitor these patients even if we can't do blood glucose curves. So I did want to spend just a couple of minutes. I know we're going a little bit late, but I think it's worth talking about the patients that are not responding as you expect to treatment. The first thing I always do is check with the owner. Are they handling and administering the insulin correctly? So I always go back and make sure that they're not making a mistake, that they haven't left the vial of insulin out in the sun and it doesn't work anymore. We might change to a new vial of insulin. So I always just check technique with the owner first. And also look again, as we talked at the beginning of this session, look for infections and concurrent diseases. Maybe do a urine culture, check the mouth for dental disease, evaluate for concurrent diseases, and including diseases like acromegaly. I would suspect acromegaly mostly when we're getting cats that are needing very high insulin doses to control them. Otherwise, it's going to be one of these other more common problems would be the reason that your patient is not achieving good control. We can use continuous blood glucose monitoring. So these are systems that were made for people and have been validated in dogs and cats. They have a little probe that goes subcutaneously in the cat and measures glucose in interstitial fluid. And it gives you a reading every 5 minutes for 3 days. So we use these sometimes on patients where we're really having trouble figuring out why we can't get good control. So the patient stays in the hospital, and I'll show you what the unit looks like. It's on the back of the neck of this cat, and it's sending signals to this receiver. And so at the end of the 3 days, we download the information from the receiver, and we can put it in the medical record, and we can see what's been going on with those glucose measurements. So this is what it looks like. This is the probe. It's a little clear piece of plastic, and there's 2 fine needles that go sub-Q in the cat. They're very, very comfortable. The cat doesn't even really feel them. So the probe goes on the back of the neck, and it sticks on with a little bit of tissue glue. It's how we secure it to the neck of the cat. And then we attach this white part. This is the transmitter. So the transmitter is reading taking the readings from the probe, and it's sending them to that little unit that I showed you earlier. And that unit is storing and recording those measurements. So this is what it looks like when the cat is set up in his cage. He's got it on the back of his neck, and it's sending the measurements there to this receiver. And then at the end of the three days, we go ahead and we download the data, and you can either get a readout. Like in this case, you can get the every 5-minute blood glucose reading, or you can ask it to graph it out for you. And so that's really nice because it gives you that 3 days worth of readings that sometimes reveals problems that it would be very hard to reveal doing traditional blood glucose curves. So in that form, the cat has to stay in your clinic, but there is another form. Again, this looks very similar, but this one stores the information in this unit itself. It doesn't send it to a receiver. So if you buy this unit, the cat can go home with it, come back in 3 days, you remove this and download it into your into a dock that attaches to your computer. So there's a couple of different versions of this. They have been well validated in cats and dogs. There's a lot in the veterinary literature about using these in cats and dogs. So if this is something you're interested in, there's a lot of reading that you can do on how to use these in your patients. So we'll just finish up long-term management. These patients do need to be seen every few months. Once they're under good control with a periodic minimum database, you might do a fructosamine on them if they're a patient where you can't do blood glucose curves, for example. Again, we would do blood glucose curves only in certain circumstances when the patient isn't stable or we've had to change an insulin dose. We would start looking at decreasing the insulin dose if we have a blood glucose that's persistently below about 8.3. If the owner is testing urine for glucose levels. Typically a diabetic cat, even a well-managed cat, has some positive urine glucose readings and some negative ones. They never stay negative. Some of them may be positive quite often, but if they're persistently negative, that means we probably need to start decreasing insulin dose. And we can look at fructosamines or A1Cs as well. If those values are falling, that might be another indication that that cat has decreasing insulin needs. Maybe it's a patient that's going into remission. This is a study that looked at owners' experiences treating cats with diabetes and found that most cat owners are able to monitor blood glucose at home, so that's good news. Glargine and PZI were the most commonly used. The PZI, of course, isn't available in all countries, but Glargine is. Most cats were on BID insulin, and most owners said that their cat was doing really well. The part that you can't see in yellow here is saying that only 1/3 of cats were on a diabetic management diet. And that's unfortunate because we do know that a diabetic management diet can make a big difference to our ability to control these cats. Okay, so let me just get to where we need to be. There is a Facebook page from the Royal Veterinary College for their diabetes remission clinic that has a clinical score on it that you might find useful to use in helping you monitor your diabetic patient. So it's very simple to use. It looks at just 4 factors: weight loss, drinking or urination, appetite, and attitude and activity. And it asks the owner to assign a score in each of those categories. So you get a total number that's out of 12. And so if we periodically repeat that score, it can give us an idea of how well the cat is coping with diabetes. So it's an additional tool that you can use along with your physical exam, questioning the owner about clinical signs, your blood work, and so on. The other thing that the Royal Veterinary College has done is let me get into the right place here, sorry. They do have an app that you can download for owners who are interested in using something on a smartphone. So it's called the RVC Pet Diabetes app. Hopefully the slide will load here for us in a moment, so you can see it. It's available for Android phones in Google Play, and it's available through the App Store for iPhones as well. So it's called the RVC Pet Diabetes app, and it's meant for owners to log clinical signs. It essentially replaces that physical piece of paper log that we were talking about earlier that we would ask owners to do for us. If owners are interested in doing it on their smartphone instead, then there is an app available for that. But I believe at this time in English only, and it's called I will put it in our chat box here for you to see, the RVC Pet Diabetes app that owners can go ahead and download from either Google Play or the iPhone, the App Store for iPhones. Okay, so thank you for staying with me to the end.